We are going to be talking about recognizing autism in adults. And if you are both providers, which I'm pretty sure you are, if I remember the registration details, then we're also talking about when to refer for an evaluation, and when to ask more questions and determine whether an evaluation is even a good fit. And so we'll be talking about all things adults. And even though we're focusing more so on adults today, some of this information is entirely relevant to like older adolescents, and it can also be relevant to high functioning, more like high functioning autism sort of presentations, because there is a pretty high overlap between those populations. And so so if I don't think I've met either of you actually, but so I'm Dr. Edwards. I am the owner and the psychologist at Magnolia Wellness and Psychology. I do have two clinicians who work here with me as well, and they primarily do counseling, and I only focus in evaluations. So I specialize in autism, ADHD, and learning disabilities for children and adults. So I see kids as young as 3. And I think the oldest adult I've had so far has been like 45, 46, something like that. And so I am a generalist, and I cover, the lifespan with each of these 3 diagnoses. So my experience, my background is primarily in testing and evaluation. And I started focusing on this population really shortly after I got licensed as a psychologist. And so training and doing more assessments and working with this population in private practice, in nonprofit for a little while. And prior to that, my training was mostly in schools. So not so much as an educational psychologist, but just doing more like psychoeducational and psychological testing for like therapeutic day schools in Chicago, some Catholic schools, private schools, and those sorts of things. So I've kind of been all over the place, but I've settled into private practice within the last several years. And so that's where I've been primarily with this population. So a lot of experience. So when I was going through what it is that I do and what topics would be really helpful, I almost always come back to adult testing, and almost always come back to adult autism testing specifically, because a lot of the referrals that I tend to get from my adult clients are usually autism questions. So we're asking questions about, do I have autism or don't I? There have been, things about me that have stood out, my entire life. And I just want to know what that is. Is it neurodivergence? Is it autism specifically? Is it something else that I'm not thinking about? And so there aren't a lot of resources really for clinicians or for clients. Well, there's emerging resources, I think, for clients to learn more about autism and what it looks like in adulthood, but there are not as many resources for clinicians or people in our space who want to know what to look for, what questions to ask, what sort of markers or indicators in their history that might be helpful for you to know when you're trying to figure out, do I need to refer this person for an evaluation? Do I need to refer them out to another clinician, and those sorts of things? So what we'll be covering today is really understanding the definitions and the characteristics of autism and how that applies to adults, looking at some key differences between how autism might present in children and how it might present in adults, and ways that we can kind of differentiate that. Of course, we're looking at some of the common signs, and I say symptoms here, but I don't really like to use symptoms. I think it's a little bit, the word symptoms, because it is a little bit ableist, in my opinion, because it treats autism as though it's only a diagnosis, when a lot of like the emerging literature, the emerging conversations that are being had, thinks of autism as more brain style and a frame of viewing the world and viewing yourself and different things like that, as opposed to, something external to them in the ways that a diagnosis can be. So we're looking at common signs and characteristics of autism. And then I think what I really want to focus on is some of the nuances that kind of show up in how we recognize autism in adults specifically. But like I said, this can be older adolescents, high functioning individuals, and things like that. And then, of course, we're going to end with some practical guidance. So how can you learn when to refer for an evaluation for more information? What are some of the indicators that you would need to refer to a specialist, and some of the questions that you can ask of the client to get some more information about that to help you make that decision? So I'll just start with the diagnostic criteria. So I don't know if you're as familiar with them. I kind of know them back and forth because that's just part of what I need to do. But I'll start here because it's helpful to know what the criteria are in order to know how someone might meet them. So the first part of autism, which is usually the one that is the biggest focus of the diagnosis, is usually in social communication and interaction. So we're looking at the ways that people have conversations, don't have conversations, the ways that we show up non-verbally, how we maintain relationships, how we initiate those, how we show up as social beings in any capacity, whether that's with people that we're familiar with, that we know, or people that are new and unfamiliar or strange to us. In order to be diagnosed with autism from the DSM-5, you have to check off all three of these criteria. So you have to have challenges in the social reciprocity. You have to have trouble with integrating nonverbals with verbal communication, and you have to have some type of struggle or difficulty with relationships, whether that is family, friends, co-workers, it can be classmates, any capacity that you are involved in, that you would form a relationship in. Those are the areas that we're looking at to figure out how you relate to other people, if there are challenges in how you do that and how you show up. So you have to check off all three of these. Within the social reciprocity category, this involves kind of I call it like your tennis of conversation. So, I start a conversation and then I pitch it to you, you give it back to me, and we're going back and forth. So what are the ways that you make comments to build off of what I've said, the ways that I interject questions to lead the conversation and continue it and keep it going. This also includes sharing our interests, sharing our emotions, any reactions and thoughts that we're having to something that's being said as well. So if you're talking about how you like to draw, I'm asking questions about, well, what do you like to draw? What are the specific things about that topic that you like the most? What is it that interests you? So I'm showing an interest in the things that you're talking about so that we can keep the conversation going between us. It's also looking at how we initiate or respond to social interaction. So if I show up in a group of people, do I like to have other people start the conversations and then I can keep them going? Or am I also comfortable starting conversations, keeping them going? Do I withdraw from conversations altogether? Am I interested in conversations? That's also another one. Interested and motivated to engage with people, whether that's in a one-on-one setting or in a group. A lot of the times what I've seen in this category specific to autism is that they can be motivated and interested in interaction and conversations if it's 1 to 2 people. But usually if it's a group or a crowd of some kind, then that discomfort goes up and that initiation and response goes down. So you'll see a bit more anxiety, you'll see a bit more withdrawal a lot of the times, and sometimes flat out escape. So they'll just leave the group altogether. Um, in nonverbals, then this is all the ways that we use our bodies to also show up and emphasize our speech. So eye contact, gestures, like I'm a very handsy person when I'm talking. So that's also part of nonverbals as well. Facial expressions, being able to show them and read them from other people. So these are some of our like visual social cues that we're trying to read, interpret, pick up on in other people that help us interpret the speech, basically. And that helps to keep conversations going as well, and increase understanding. So we're looking for any challenges that we can have in those. And then third area, of course, we're talking about relationships. So this is making friends, keeping friends, being interested in friendships or relationships with anyone. So if they don't have friends, but they have pretty active family members within their household, this could be, how often they're engaging or interacting with their family at home, or if they are preferring to be in their room, just kind of doing their own thing. That can also be an indicator of struggles in the relationship arena too. And then, of course, another aspect of this too is how we adjust our behavior in a social context to further a relationship or to maintain a relationship in that way. So I'm adjusting, body language or volume to fit, a one-on-one conversation versus a crowd, or I'm adjusting how I interact with family versus strangers or friends, or in a professional context versus in a close friend group or something like that. So we're looking at the different tiers of these categories so that we can determine, do they check the box or don't they? The second criteria, and it's important that we check off at least 2 in this category, and it's 4 criteria altogether, but you only have to check off 2 of them to meet criteria B, versus criteria A, we need to check off all 3 of those. So you need predominantly more challenges in social relationships and communications than you do in the restricted, repetitive interests and behaviors category. So in this category, criteria B, are some of the ones that I think have become a lot more evident in blogs and social media and kind of buzzwords and different things like that. So we have like our sensory stuff. So our sensory sensitivities to noises, textures, foods. We also have lack of sensory arousal. So we have like a really high pain tolerance, or we're indifferent to certain social or sensory input. So this might be like needing to have things repeated to you multiple times before you process it or something like that. This could also be not responding to certain temperatures. Like if it's super cold and everybody else is cold in the room, but you're not, that might be an indicator. It's not always, but sometimes it can be an indicator that there is some sensory processing stuff that's going on. We have our repetitive motor movements and speech. So this is echolalia. This is the lining up toys. If you've ever heard of or seen kids who play with cars and they want to spin the wheel most of the time, that is considered a repetitive behavior. This might be any sort of stimming, so rocking, pacing, finger flicking, like those sorts of things. Tiptoe walking can sometimes be considered a repetitive movement or a stereotype movement, but that's not always the case as well. We have our preference for routines and our challenges with changes in routine. So we're talking about not just necessarily someone who doesn't like things to be different, but we're talking about significant distress of some kind to a change, no matter if it's a small change or a big change. So a small change could be something as simple as, having to use a different laptop for your work. And to a big change might be, having to use a different route to get to work. And those things being distressing and not being able to come up with like an alternative in the moment, because I'm so anxious, I'm so distressed by the fact that this routine and this transition is happening. This might also include transitions between preferred activities and non-preferred activities. So I'm going from, using the drawing example, I'm going from, drawing or coloring to now having to clean up my room. And that being either a slow transition or an what is it, like an inflexible transition. So in order to, go from drawing to cleaning my room, I have to have this, and this in place. And if those things are not in place, then I cannot do this. I can't make that transition. It's not seamless. And I can't do it. Therefore, I'm not doing the chore. I'm not cleaning my room. So it can be very rigid. It can be very black and white, very inflexible in the way that they're, approaching it, thinking about it. Thinking patterns can also fall in this category as well. And they can show up in insisting that your way of doing things is the best way and the only way to do it. And if you can't do it that way, then it's not happening. So the insistence on sameness and routines and kind of that ritualized pattern of behavior, all of those things can fall under this category. We talked about sensory concerns. The fourth area is our special interests. So this one is always kind of tricky because some of their specialized interests can be what are basically socially appropriate. Like they can be regular hobbies. Like I mentioned drawing, it can be collecting things. It can be learning about certain things, but usually the difference between a regular hobby and a fixed interest is the level of intensity, the preoccupation, and their attachment to the topic. So a good example of this would be, someone who, trying to think of a specific example that I've gotten in one of my cases, would be, I'll use art as an example. So this would be someone who enjoys drawing wolves. And so they want to know all the different types of wolves. They want to know, what are the textures of their fur. They want to watch videos about how to differentiate between drawing a snout versus drawing a paw, or different things like that. They're really diving into the research in that topic, and it goes beyond just like a typical interest in a hobby. It feels obsessive, it feels excessive, and usually it feels kind of weird when you hear about it. Not to say that the topic itself is weird, but usually when you hear about how intensely interested they are in that topic, it feels above and beyond a simple hobby. So this might be, in children, this might look like, a kid who's just really into like Sonic the Hedgehog. So they've watched every episode of every iteration of Sonic the Hedgehog. They have their room decorated with Sonic characters. They draw Sonic whenever they have free time. They are watching YouTube videos around Sonic. So it is above and beyond just a simple interest in the character itself. And it's become just like a circumscribed, sort of persevetive almost, like I'm fixated on learning everything that I can about that. And that's usually the difference in how you tell a special interest versus like a typical hobby. So some of the key differences between childhood and adulthood usually comes down to, and I just pointed out the main four that I've seen more so in my work, but there are a couple of others that pop up in here as well. And I mentioned them in several areas here, but usually it's the difference between what is overt and what is subtle. So with children, unless they fall kind of on that higher functioning Asperger's kind of side of autism, most of the time it's very obvious that they meet the criteria in one way or another. So for children, it'll be, they're fixated on like a TV show, or they don't respond well to the sound of vacuums, or they can play with other kids, but they play in their own space as opposed to sharing their toys or playing with the other children. They're noticeably separated from other kids. The subtle presentations of these would be, I can have a conversation with people, I can interact with people, but it's distressing for me internally. Or I might be anxious the entire time that I'm doing that. So it looks more like social anxiety as opposed to just like overtly having trouble with back and forth conversation. I've talked about the interest piece of it in terms of the subtleties in that, but it could also be like I'm able to make eye contact with people, but I don't like it. Or it looks like I'm making eye contact with you when I'm actually just looking over your shoulder, or I'm looking at a specific spot on your face so that it looks like I'm interested. But and to the casual observer, it looks like you're looking at my face, so you're paying attention to me. But in actuality, they're just looking in that direction, but they're not actually integrating that with what they're saying or how they're saying it and different things like that. So those are some examples of obvious presentations versus subtle presentations. And the subtle presentations, I think, are what you have to ask more questions about with adults specifically, because adults have longer histories. I don't have to spend as much time gathering background details for a 6-year-old as I do a 36-year-old. So there's more information to sift through and more information to or more, what is it, more like tangential sort of things that don't seem related or that they can't possibly be related that we have to ask questions about. So we're asking about internal experiences as well as overt experiences. We're asking about emotions in the same ways that we're asking about their special interests. Sensory preferences might show up here as well, because one of the main things that tends to be focused on a lot in like most blogs or presentations around autism is our sensory avoidance. So we're avoiding loud noises, or our sensory sensitivities, say, loud noises and textures and foods and those sorts of things. But you can also see sensory seeking behavior also show up in autistic people. And these are things that I ask more questions about in adults, because they do tend to have equal amounts of sensory seeking as they do sensory sensitivities or avoidance. So an example of this might be a preference for loose fitting clothing, or a preference for sweaters as opposed to jackets, a preference for leggings versus jeans, or I say dresses, or like looser fitting sort of things. More so, I think women that I've had this conversation with, and avoiding like cotton or satin because they don't like the way that it feels. But when they're seeking out certain sensory textures, they do like the way that it feels against their skin. It's not as uncomfortable for them to be in a loose fitting t-shirt and leggings as opposed to jeans and a top or something like that. So we're asking questions about their entire sensory profile as opposed to just their sensitivities or the things that they don't like. So masking and coping, of course, shows up in a lot of the ways here as well. And that's a big factor in any sort of evaluation and questions that we ask about adult autism, because a lot of them have more than likely learned how to camouflage and blend in, whether that's a conscious effort or an unconscious effort. In the ways that we've learned how habits build or they come about, then, you know, we learn that we can do things in a way because we've done it over and over, and it's become just a part of the way that we show up. And some of them are not even aware of it until we start to ask these questions. And they're like, oh yeah, I do, you know, pay attention to the way that people say things so that I can copy it and do it the same way that they did in conversation. Emotion regulation is another one. In kids, this might be like behavioral and emotional outbursts. And in adults, this might look like, it can be outbursts as well, but you also see emotional blunting, so shutting down completely in response to any sort of overwhelm. The main thing to know for adults is that the behaviors can be incorporated into acceptable hobbies and unstructured routines, to the point where If we only ask if they have problems in these areas and they're not identifying it as a problem, then we won't know. So that's why it's more important to ask questions about the how. So we're focusing less on what they're doing and more on how they're doing it. I say more on how they're doing it, but I think it's really like an equal amount of both. I do also focus more on the process, the how of things as well. Common signs and characteristics. So these follow really the criteria pretty specifically, honestly. So the common signs and characteristics that we see in children, we can also see in adults. So that's not to say that adults can't be textbook autism and that they're always high functioning or that they're in like the Asperger's range. A lot of the times, adults that come to me, I'm baffled in how they haven't met criteria before now. And most of the time it's because their behaviors have been explained away by personality factors, by environmental factors, by the friends that they had a lot of the times, sometimes them having trouble reading social cues or body language or jokes or sarcasm or different things like that have just been put down to just a lack of social skills and not necessarily being attributed to a possible, autistic trait. Challenges in conversation might be put down to I'm just a shy person and I don't like to engage, and that can also be true. And you can also be autistic and be a shy introverted person as well. Understanding small talk and conversation and the flow of a conversation. Usually the difference between someone who's just generally introverted and an introverted autistic person is that the autistic person has more trouble understanding and staying in the flow of a conversation versus a typical introverted person. They can show up and be present and go with the flow of a conversation if the conditions are right, basically. If they're comfortable, if they know the people, if check in, fill in the blank. Usually this is also literal interpretations of everything. So jokes, sarcasm, passive aggressiveness, general like phrases can sometimes be taken very literally. So if I tell you, I'm thinking of a specific phrase in mind. So like a bird in the hand is worth two in the bush. Sometimes they're literally thinking about like, are there birds in the bush? That's a very, very simple remedial example, but that's how literal things can be taken sometimes. Or you might ask a question and you're trying to get at what it infers or what, the underlying meaning of that, but they only answer the question that's asked, the details of the question in there. We might have, of course, the difficulty in forming and maintaining relationships, but this can also show up as, they're able to make friends and maintain those friendships up to a certain degree, but out of sight, out of mind, I think it can show up a lot easier within the adult autism population because they have more trouble remembering to check in on those friends and check in on those friendships if they're not seeing them and interacting with them every day. So this might be, I've gone a couple of months and then suddenly I remember, one of my really close friends, I haven't seen her or talked to her, in a while. And so, hey, let me check in with her. This might be losing a sense of connectedness to the friendships that they've had. The friendships that they've had for years. This might be losing touch with someone that they've known since grade school and not reconnecting with them until college. And a lot of that is relatively normal, but it's the way that they think about it and that they go about it that makes the difference. I talked about the sensory seeking and the sensory sensitivity. So we're talking about, I talked about clothing specifically, but this might also be like seeking out certain types of food because I like the texture of it and it helps me to calm down before an exam. This might also be, I don't like to go to the mall because there's too much noise or there's too much, what is it? There's too many people, there's too much energy, around me, and I can't concentrate. And so it feels overwhelming to the point of distress. I've also had a couple of people who they seek out certain types of crowds because it's comforting. So I had someone who didn't like the restaurants because it's too many people, it's too busy, it's too many things happening at once, but they enjoyed seeking out concert crowds because they liked music and they vibed well with the crowd and the people, and there were unspoken rules that they knew how to follow within that crowd. So that's a good example of they can meet the criteria, but the presentation of it might change based on what they get out of it, what comfort, what soothing, coping strategy they might get out of that. And so I would have never thought to ask or consider that someone might be comforted by certain crowds of people, but repelled by other or distressed by other types of crowds. So that's something I think that we need to keep in mind with that. When we look at the repetitive behaviors and the interests, we want to look at what their routines are, what sort of ritualized behaviors they might have. And this can look similar to OCD, but the difference is in the compulsion. Like they have more of the obsessive thoughts around following a routine, but they're not necessarily compelled to follow that routine because something bad is going to happen. It's usually I need, these things to be in place for this routine in order to get something else done. It is usually a lead into being productive or doing something else. And it's distressing when those things are interrupted for them. Any stemming sort of behaviors. So these are our repetitive behaviors that are soothing. This can be fidgeting. This can be nail picking. This can be any sort of physical action, tapping your foot. Pacing can be in part of this. Something that it's not necessarily repetitive behavior, but it can kind of fall into the sensory category is like in children, this might look like wanting to be squeezed or held. For adults, this might look like a weighted blanket, wanting to sleep under a lot of covers. This might be the opposite, like not wanting to sleep under covers at all, because it's soothing for them and it regulates any anxiety they might have about sleep. We talked about interest in a lot of ways and then those changes. But like I said, with the interest, the thing that I always look for is the intensity of the interest and how long they're spending with that particular interest. So do they own and how long that has been there? Have those interests changed over time? Have they evolved? Have they, did you like, drawing cats when you were younger and now you draw cat people? Did you like, what is it, like coloring things when you were younger and now you spend large amount of time doing chalk, was it like chalk painting or charcoal painting, or drawings or things like that. So we're looking at the progression of their interest and the progression of that intensity, because sometimes it evolves to become more socially acceptable. And then sometimes the intensity is still the same, even if the topic has changed. So they're not interested in learning about wolves anymore. Now they're interested in learning about bears, but the category is the same. It's animals and people. Something that I have seen a lot more so with adult women when I do evaluations is that most of their interests fall around something artsy, or around like social behavior. So they're like sociologists almost, like they want to know how to show up in front of people. And sometimes it's not always a special interest, but I also ask them how much they've learned about autism, how much time they've spent researching this topic and what they know about it, and can they tell me about it? And I asked this question because I've had, and this is pretty consistent. I don't have any research to back this, but it's pretty consistent with my adult women population. I have literally had someone come with a binder full of research that they looked at around autism, how it shows up in women, how it shows up in adults, the difference between autism and ADHD, the difference between autism and OCD. Like, it was so well put together that I would have loved to use it in my clinical work because it was so thorough. And it was down to the finest detail of diagnostic criteria and things that they learned on TikTok. But they compiled it into a PDF document and printed it out and put it in a binder. So that is usually when you hear specific examples like that and you're like, huh, that's kind of odd. Usually, more often than not, it can be an autistic trait or a neurodivergent type of trait. So asking questions about, what's it like for them when they are engaging with their interests. Those are very good questions to ask. This one is not necessarily a criteria of autism, but it can overlap and show up pretty easily in this population, and it's around executive functioning. So a lot of the times we attribute executive functioning challenges to like ADHD or as a byproduct of like depression or anxiety, but those same challenges can show up in autism. And that's one of the reasons why it has a high co-occurring rate within the autistic population. And so we want to ask more questions around this for adults as well. In their organization, managing time, how do they plan and prioritize? Not so much do they have trouble with it, but what's their process and how they plan and organize things? How do they determine what to do first, what to do next, those sorts of things. Usually the process, the underlying, the way that they approach these sorts of things will give you more indicators of if it's an autistic brain style or if we're looking at more an ADHD type presentation or both. Procrastination and motivation. We want to look at is their motivation related to disinterest? Is it related to anxiety? Is it related to, I know that I'm going to have to work hard to do this thing, so therefore it takes me a little bit longer to get started? Is it related to a certain routine or ritual that needs to occur before I can do that thing? So we want to be looking at and asking more, or not even, you can ask more questions around this, but you also want to pay attention to how they're responding. Something else that can also be something to think about. It's not always characteristic of autism, but it's how they describe their emotions, how they describe their internal emotional experience. Can they give you like a, what is it? Like a description of what it feels like for them to be happy or angry? Can they give you an example of a specific situation that made them feel angry and what they did, how that felt for them internally, and those sorts of things? A lot of the times what I've seen is that they can label the emotion, but they can't always describe what it feels like for them to have that emotion. So that insight and that awareness can be lacking in that way as well. And then sometimes I have people who are very emotionally in tune, very emotionally aware and insightful, but they have trouble identifying that in the other person. So they're aware of their own emotions and their own experience, but they have more trouble picking up on that in other people. And so this all gets in the way of them being able to manage their daily life and things like that. So some of the main nuances in recognizing autism, I've already covered several of them so far, but we can group them in a lot of different categories. And this is usually what complicates how to recognize autism and how we diagnose it. And the main one is masking, masking and camouflaging. So in case you don't know what that is, it's basically a defense mechanism in a lot of ways and a coping strategy that has helped them to consciously and unconsciously kind of suppress or blend more into the neurotypical kind of socially acceptable crowd or behavior, so that they kind of meet the expectations for quote unquote proper appropriate social integration. So it can complicate recognizing autistic traits and autistic brain style. It can lead to misdiagnosis. It can lead to being missed for a diagnosis, and it can also lead to burnout. So there's something that's called autistic burnout, and it looks very similar to like stress and workplace burnout, except it's primarily related to masking autistic traits. So good example of this would be someone who on the outside doesn't seem like they have like social difficulties or social challenges, because they're able to laugh on cue, have conversations with people, smile when they're supposed to, pick up on the cues from other people, but they need 2 to 3 days to recover after this interaction and this experience. A good example of this that I had a couple of months ago was this woman who, she was about 25-ish, if I remember. She worked as a NICU nurse, and she worked on day shift initially, but because she was doing so much interaction, and it was appropriate interaction, so but she wasn't always good at it, if that makes sense. And so she was doing a lot of masking, a lot of camouflaging, to the point where it was starting to affect her work. So she was focusing more on being social and keeping up with social behavior in that way, to the point where it was starting to get in the way of time management, organization, get in the way of her managing her workload. And then she started to get overstimulated by the busyness of a NICU and all the things that go on, in that environment. And it led to her having to switch to night shift. And then eventually she switched to PRN on night shift. And over time, it was starting to burn her out because she was doing so much masking. Examples of this might be like forcing themselves to make eye contact because they know that it's appropriate, but it makes them uncomfortable, so they're doing that. This might be paying attention to how someone makes facial expressions to show interest, and then I mimic that to seem like I'm interested because that's what I'm supposed to do. This might be what's another example of this? This might be someone listening to or paying attention to their favorite sitcom, and the ways that, someone walks into the room and greets someone, and then they do that exact same thing every time, they walk into a room and greet people. So those are some examples of behaviors that might replace the challenges that they might have, to the point where it doesn't look like they have challenges, but they actually are distressed or uncomfortable, or anxious, or any of the above. Of course, some of the gender differences that show up in adults, we have more so in women and non-binary people, or gender non-conforming. Just usually it's just the impact of gender and how it shows up in their presentation. So this might be specifically, women tend to be more socially adaptable. They tend to be more socially conscious and insightful in that way, to the point where they can pick up on the areas that they are struggling in, and then fill in the blanks by watching other people, by paying attention to how other people are expressing themselves about a certain thing, paying attention to the certain topics that tend to be more popular in conversations, and then talking about those topics, even if they have no interest in that topic itself. Men and boys specifically, and I'm talking about those assigned male at birth specifically, tend to have more of the stereotypical autistic traits. Not all of them, but the majority of them do. Cultural considerations to take into account is really how social behavior is viewed from a specific cultural background. So there are certain expectations around what is appropriate versus what is inappropriate social behavior, what is how to communicate with people in an individualistic versus a collectivistic culture. Eye contact is one of the ones that comes to mind. In certain cultures, making direct eye contact is seen as offensive. So if someone is from a different, if someone is from that type of culture and they're not making eye contact with me, does that mean that they're autistic? maybe, but it could also mean that in their culture, eye contact is not as important. So I need to, take those things into consideration and weigh in on the other things, and the other ways that they might be meeting criteria for that. And getting a sense of their internal emotional experience to, the different things and the challenges that they might be having socially or with any of the other behaviors. Co-occurring conditions can also make recognizing autism in adults really difficult. And I'm pointing out more so the women population for this, because more often than not, they tend to get diagnosed with anxiety, depression, borderline personality is one that I've seen a lot of people end up with, OCD, social anxiety, all of those. And sometimes ADHD can also be identified before autism is, or it's being misidentified as social anxiety when it's actually autism. And so we have a lot of those sorts of presentations that can overshadow what look like more subtle autistic traits. But then there's also research that shows that more clinicians, doctors, providers, fill in the blank there, tend to identify autistic traits in women and attribute it to other diagnoses before autism is ever a question. So if they're having trouble with social interaction, for example, they might be more likely to attribute that to a lack of social skills, or as to being introverted, or if they're not motivated to be in a group of people, they might attribute that more to social anxiety or depression. Or if they have really big emotions, a lot of the times they're described as dramatic or overly dramatic, and then that can be described as borderline. And we're not considering that these can be autistic features or presentations as well. So that can lead to misdiagnosis, a missed diagnosis, and incomplete understanding of that person and how they show up and how their autistic brain style shows up. And so how do we know when to refer for these? What if I've gone through all these things and I still have questions? Usually it will show up as a lifelong pattern or a long-standing pattern of social awkwardness, of isolation, of relationship problems, of social challenges in general, whether that's in conversation or in nonverbals or anything like that. So we're looking for not just an isolated couple of incidences. We want to know, did this show up in childhood? If so, how? In what ways would they have checked off the box in childhood as well? We want to look for a history of feeling different or out of place, or feeling as though they have never been able to be themselves. So a deep, deep sense of not fitting in with other people. And this is not just, fitting in with the uncool kids in school, but this might also be in college, identifying more with a certain club or a social group because they identify more with their interests or things like that. Something else that can show up here is, and I don't think I have it in the slides, but I think it's also important, is asking if any of their friends that they do have been diagnosed with autism or ADHD or anything at all. You don't necessarily have to say, have your friends been diagnosed with autism, but ask, have any of your friends been diagnosed with anything? And what this usually shows is kind of anecdotal, but a lot of the times people who are neurodivergent in some ways almost always end up in friend groups with other neurodivergent people. And so then you can ask more questions around, well, what do you like about being in this group of friends? What feels comfortable for you in that? Of course, you want to look at how they show up in conversations, their nonverbal cues, how they interact with sensory sensitivities, as well as their sensory avoidance and their sensory seeking. So what sort of sensory experiences are they seeking out as well? For soothing, usually if they're seeking out sensory experiences, it's for self-soothing or for comfort. It's very different from like an ADHD sensory seeking type of situation where I have too much energy in my body and I need, to find an experience that will help me release it. Usually I'm seeking out certain sensory, sounds or touches or textures because it's soothing and it's minimizing distress for me. We're looking at the deep, intense focus on certain subjects, hobbies, and interests, and we want to look at how it dominates their thoughts to the point where it excludes all else. So, how much time do you spend drawing? Is it hard for you to stop drawing and start to do your homework or to go out and engage with your friend group on a Friday night or something like that? Looking at our stemming behaviors, we want to look for recurrent and chronic emotional challenges. So anxiety, depression, burnout, we want to look for the dramatic presentation because for our women, a lot of the times it can be described that way. And we want to look for these things that are not responding well to traditional counseling interventions. So if you've been in therapy for like chronic anxiety and depression and it's not improving and it's not making sense anymore why we're implementing solutions and it's not getting better, we might want to start looking at some of these other factors. And if these dots all start to connect with each other and you're starting to see a pattern, refer for autism and autism evaluation, or you can refer for actually, I would just refer for an autism evaluation, not even just psychological. And then we also want to look for any self-reports, any internal experiences of exhaustion, of discomfort, of needing to recharge after social interaction. So I'll use the NICU nurse as an example. Whenever she had two work shifts in a row, she needed at least 3 days off before she could work again. Or if she had two night shifts and she could not socialize or see her friends or go, to a restaurant for at least 3 days. Like 3 days was usually her recharge period. So we want to be asking questions around that as well, because we're getting at exhaustion and discomfort, even if outwardly they're able to do it. So sometimes it's not, can they do it or can't they do it? But it's, again, it's how, what's the process? What's the underlying things that we need to, be aware of and keep in mind. So what are some of the questions that you might be asking to these clients? And so to keep in mind, whenever you're asking questions, you want to ask more open-ended, reflective questions as opposed to a close-ended yes or no, like any question that would just draw a yes or no answer. And you want to allow them to reflect on their experience so that we're not applying any labels just yet. We want to just understand, what their life and their experience has been like up to this point. And this will provide a clearer basis, usually either for the client to understand themselves or for you to know, hey, I'm still not quite sure. Let's just seek an evaluation just in case. Some of the questions that you can ask are about, if not so much if they feel understood, but have they ever felt misunderstood in conversations? Is it sometimes hard for them to understand what other people mean? Those specific questions you want to ask in more of an open-ended way and not just do you or don't you. There might be instances where you ask, how do you feel when things don't go according to plan, or if your routines are interrupted? Are there certain times or tell me about certain times where you feel more comfortable talking about certain subjects than others? Are there certain subject matters that other people talk about that you have no interest in? And so you want to get more at the process and the how, and get more information about how these things are showing up and how they're responding to them as well. And so I did kind of go through those pretty quickly, but are there any questions about any of the presentation, the how to refer, when to refer, what questions to ask, or different things like that?
Does Does social media scrolling, does that play in at all?
You mean
Um,
like scrolling, like screen time?
Screen time, games, would that be something? Would that be kind of one of the uh, interests, kind of the obsessive type interests?
It can be. It would depend on what they're getting, what they're getting from scrolling social media. Is it because social media specifically can be tricky because I think we use it in more of a habitual way. Like I have
Hmm.
10 extra minutes, so let me just check Instagram really quick, or let me just scroll TikTok and see, kind of what's going on and kill time versus, people who I'll use the autistic woman from earlier who had the binder. She was scrolling TikTok to find more information about autism so that she can add it to her binder. So
Okay,
that's
yeah.
more of a process related sort of question to ask, like, hey, what are you getting out of spending so much time on social media? Is it comfortable for you? Is it because you're bored? You don't have to provide specific examples unless they can't come up with something.
Hmm.
Um, Screen time, I do ask questions around screen time because sometimes it can contribute to sensory overload, and it can contribute to sensory sensitivities. It can contribute to sleep, and that's not always specific to autism. But like I
Right.
said, more so of those, you want to get at habits that they have and why those habits are there and what they get out of those habits.
Okay.
Yeah.
Okay. All
Any
right.
any other thoughts or questions?
Um, so I obviously I'm thinking of people I've worked with, and um, kind of questions, past and present, but
Hmm.
any kind of things that kind of stood out for me. And I work with a lot of older people who, maybe had done well with their family or their spouse, and then the spouse is gone,
Hmm.
and life is extremely different.
Hmm.
Um, and this going misdiagnosed, um, is definitely out there. I just wonder. I guess I just feel more prepared to ask them some other questions and look at things other than depression,
Right,
anxiety.
right.
Um,
Hmm. Yeah, I've gotten a lot of, and I'm using women as the example because they're the ones that I think I get the most referrals for. I have had some
mhm,
adult autistic males that have reached out to me to get more testing, but usually it's women who end up wanting more information around this. But um,
mhm.
what can also show up is how other people have accommodated them thus far. So a good example of
Okay.
this, I had an autistic male who showed up, and he was married, had a family, and he always had this reputation in his family for being kind of the oddball black sheep type. And so his family had accommodated how they interacted with him so that it would, increase, their understanding. It would motivate him to interact back with them. It would like minimize how awkward things got during dinner time because they knew like how to ask certain questions or how to phrase certain things. And the issue for him really came up in his marriage when they started to have problems and they were trying to work through the problems, but he wasn't connecting the dots between how she was asking him questions about his experience, his internal reactions to certain things, and he wasn't able to describe it. And that was the first moment where they started to question, like, hey, this isn't really making sense. Is there something else that's going on? And then they started to look for that pattern in his family relationships and in he was also in group therapy in a men's group,
Mm.
and was also asking his therapist, the wife was asking the therapist questions about how he showed up in the group. And it was very similar to what she was seeing and how he was responding to her in their conflict. So those are very good examples of, and he was, I think, like 35. So
Uh-huh.
he had been accommodated, and he was relatively smart. He didn't have any social challenges or conflicts with coworkers at work because his work environment, he only had to go into the office 2 days out of the week, and his group was like 5 people. And he only had to interact with one person out of that 5, and they had lunch together maybe like once a month. So his work environment had even been accommodating him and his challenges in that way without him even knowing or noticing, because he just gravitated toward that environment because it was more comfortable for him and it met
Right.
the criteria that he had. So those are very good examples of, on the surface, when we're asking, do you or don't you, or do they check the box in this way? Are they able to or unable to? How we might not get the answers that would help us answer this question unless we do deeper, more reflective sorts of conversations, and we're thinking outside of the box in
Right.
terms of what could be, providing challenges and what might not be. With that specific client, I would not have thought that his work environment would just naturally accommodate him, because
Right.
he gravitated toward that on his own, as opposed to seeking out workplace accommodations. It was just something that happened, and his family really just learned how he showed up, and then they adapted how they showed up with him so that he could be himself. But he was still withdrawn even from his family, and they were okay with that. It wasn't a problem for them. So sometimes, they might show autistic traits and characteristics, and they don't identify them as a problem. It's just always
Mhm.
that they've been. And so we also need to kind of think about how we're phrasing like things as being challenging or a problem or trouble with. And sometimes they might not have trouble with them. Sometimes,
Right.
they it just might be, part of their experience, and they don't see it any differently.
Mhm.
Yeah.
Yeah.
Um, Something that I know we're out of time, but something I want to impart to more so around the masking and camouflaging, because those are important questions to ask with your adult population. I do use, and you can find this online as well. It's a measure called the CAT-Q, so it's the Camouflaging Autistic
Uh,
Traits and Questionnaire or something like that. CAT-Q. Um,
mhm.
and it's not specific to autism, because it can show up with like high functioning anxiety people, high functioning depression people. And so you want to not pay attention necessarily to just their score that they get, but also which questions they endorse. So
Mhm.
is it around like more social anxiety types of situations, or do you see more endorsements in like mimicking facial expressions, mimicking body language, spending more time recharging? Like you want to, pay attention to more of those types of questions in there. And I want to say there is a PDF of the questions that you can download online that can show you those as well. But I use that in all of my adult autism evaluations, and I pull out those specific things that they rated to show how they're masking, not just if they are, but how
Mhm.
they are, and how they can cope with that and unmask if they want to.
Okay.
Yeah, that's really
Cool.
helpful.
Thank you. Thank you
Yeah.
very much.